thank you for doing this interview and helping us with this project. I know that leadership is an essential component of nursing, and in our studies, we wanted to find out more about leadership, and that's the reason why we're interviewing you today. So before we get started, can you tell us a little bit about yourself and your current position?
Okay. My name is Richelle Retener. I have been a nurse for more than 17 years. I started as a nurse, as a staff nurse in ICU. I was there for 7 years, and after 7 years, I decided that I wanted to have a little bit of change in my life. So I applied in a position in a different field of nursing, which is a long-term care, and I took a job as an MDS coordinator, and it's probably a position you guys don't hear about, but it is pretty much the life and the soul of any rehab facility, because this is how they get paid, and this is where the care planning centers are around, which is the MDS. So I was in charge of the MDS and the care plan component of the nursing facility. An opportunity knocked on my door after I've been doing the MDS for many years, that they needed a DON for the facility that I'm working for now. And I was hesitant to do it in the beginning because it's a big role. It's very different from the role that I had. I had one component of the facility, and now I am in charge of the entire thing. So in the beginning, I didn't want to do it. I didn't feel that I was ready to do it, but I eventually took the position, and they gave me some training, but like any other position in nursing, it's experiential learning.
So what made you want to be a nurse leader?
I really didn't choose it. It was presented to me as an opportunity for growth, and I said I was going to try it for 2 years, and I've been in that position for about 6 years. So it tells you that if somebody offers you something, a position, because they see a potential in you, so you don't always close the door, and you try to keep it open and try it, and give it about a year or two if you could do it. Okay.
So Richelle, how would you describe your leadership style?
My leadership style has evolved in many years. I started one way, and I'm still evolving right now. I probably, going back to your text, you probably have different types. In the beginning, I was more authoritarian in the beginning, because you want tasks, you're new at the position, you want certain tasks to be completed, certain things to be completed, so you don't really have you don't give a lot of leeway with your staff. Throughout the years, I realized that type of leadership does not work for my facility. So in different situation, you wear many leadership hats depending on the situation. I aim to have a leadership style that's more transformational and more inclusive of everything, and a little bit of shared governance, which is I allow my staff to let me know where they want to, what direction they want to pull for that particular year, for that particular survey year. But so I started authoritarian, and then maybe I more so transactional most of the time. There's a couple of times, like last week during our survey process, I was not a transformational leader. We have a task that we have to complete.
So it's more like you use like situational
stuff.
leadership.
Yes.
Where you apply different leadership styles
depending on the situation. Like last week, during a visit from the Agency of Healthcare, and this is our annual survey. So they come in and they visit and they check everything in the facility, from infection control to med pass with the staff, dignity, every single component of running a facility. So in that particular week, I was not a transformational leader. I was not a laissez-faire leader. There's no shared governance. It was transactional, to make sure all the tasks are completed. Everybody has their task and they have to complete it. So
So which leadership style right now do you feel most comfortable with, and what factors made you choose that style?
I would say I aim to be a transformational leader, that you want your staff to go above and beyond their duties and to motivate them to find the passion in nursing so they could do their job very well and they could have some professional growth. Um, like in scheduling, I'm gonna go back, like there's in my job, like you're pretty much responsible for everything, but I don't do everything. You know, I have people, certain people that are responsible for certain things, and they have to be accountable for those certain things. I have a full-time scheduler, although every morning I have a meeting with her of how my staffing looks, make sure that we're at par with the agency, with what the state requirements are. But also we are also looking at our census, the acuity of the patients, to make sure we have enough staff for, you staff based on acuity. So in that sense, when it comes to scheduling, yes, you're transactional, you want the schedule to be done, but I also am a little bit more democratic with scheduling. Like if a staff, they have a certain schedule that they have to follow, but let's say they have a wedding to attend, they have an exam in school that they have to
So you're
be there.
flexible.
I'm very flexible because I want the more they learn and the more they go to school, the better the nurse they will become. So there's a give and take relationship in there, and I actually allow them to, if they want to be off a certain day, I always just tell them, you could ask some of your peers to cover for you to change schedule. You just have to have me sign a make them sign a paper, a commitment that they're gonna cover for you for that day. So they have more control over their schedule.
And I'm assuming that by doing that too, then they will kind of do more for you as well.
Yes.
So in that spirit, so what kind of practices that do you use to motivate your subordinates to perform more effectively?
A give and take relationship. I am more of a lot of the times being a DON, I think I'm more criticized that I don't delegate enough. But, delegation, and we're going to go over it, it's part of your leadership as a nurse. When you become an RN on the floor, you might not feel that you're in a leadership position, but you are. The moment you step into the hospital and you have a PCT, a CNA, an LPN under you, you are assuming a leadership role. And there's certain things that you need to be able to delegate. And delegation is a process wherein you're able to delegate a task that is appropriate and make sure you're able to follow up that the task is done. And the bigger part of my role is delegation. Like I'm here right now and I have my staff in my facility, but all of them knows their responsibilities and they're accountable for their responsibilities. So when I come back to the facility, they'll give me a report of what's done and what's not done, what's pending, and what is our goal tomorrow, mm-hmm. or the next week, or for the month. And so that too, the delegation part is also it also motivates them, because when you delegate, you empower them, and you might not think so, but it is. You give them a task, and they perform the task very well. And they have a sense of ownership of that task or that responsibility, then you allow them to grow and you allow them to empower themselves.
Yeah, I think empowered employees are engaged employees. So how do you increase your employee retention? Because I know you spend a lot of time training, and a lot of times people will want to leave. So do you do anything differently to try to retain people and increase engagement?
Aside from giving them a little bit more flexibility with their schedule that not a lot of places would give, you also want to make sure that they're not rewarded, but during their evaluation, when you evaluate their performance, that you give positive feedback and and areas of improvement. And then I spent a lot of time, sometimes one-to-one with particular nurses that I know is not up to par with their skill set. Like if they're not very comfortable with assessing, they're not very comfortable with putting an IV, I pretty much go with them one by one. I insert an IV tomorrow, I'll tell them, it's now tomorrow, you're gonna do it on your own. I'm gonna be next to you. and then until they feel more
So
comfortable.
you try to increase their competency.
Yes,
So that
yes.
they will feel more comfortable doing their job.
It's the kind of the double-edged sword,
Mhm.
because then they feel so comfortable that they're ready to venture out into the hospital. So that is my biggest challenge in my work. Like, you empower them a lot, then they become confident that even if you're not there, you know that they're gonna do the right thing. They're gonna keep the patient safe, but at the same time, you also increase their desire to
To
move upward in their
Mhm.
career, which I never deter them from doing.
Well, that's a sign of a good leader.
Yeah.
You never want to keep your employees back. You always want for them to grow.
And I also, what I do too is I cross train, because in a nursing facility, the tasks are kind of like very divided. Like, I'll give you a perfect example. Like, I'm the DON, I have an assistant. This is like the structure of our leadership. You have an assistant, which is an ADON. She's responsible for, she is mainly responsible for the education, the staff development, infection control, and some part of quality assurance, which is like to make sure that any like things in the facility are working to its maximum potential. So she's responsible for that, and then I have 4 different stations. I run a 230 bed facility, and I have 4 stations. Each station has their own charge nurses, and then those charge nurses have their task at hand, and then underneath those charge nurses are your staff nurses on the floor.
So you've got a lot of people reporting under you. So what
Yes.
are the challenges that you face in your as being a leader and trying to manage that amount of
Mostly
people?
personality conflicts. I spend most of my day, some people, for team building, some personalities don't match with a certain personality. Let's say I have a charge nurse, and under her there's a couple of nurses under her. That maybe one particular nurse is not comfortable with that particular person's leadership style. So my challenge is to put that nurse with a charge nurse that they actually could work together, because most of the time you're resolving conflicts on a daily basis. Like, you come to work, you check certain things, but most of the day you have to be a problem solver. There's things arise from different parts of your facility, and you have to be ready to resolve those conflicts. May it be an emergency, may it be a family member have certain concerns, or it could be a staff-to-staff concern, which is most of the time you find that a lot.
Yeah, so based on what you just said, it sounds like you face a lot of challenges day to day.
Mhm.
So what characteristics do you believe that every leader should possess?
I think that person has to be flexible. They have to be fair. They have to be able to inspire and motivate people. And that's very hard to do. I think that part of being a leader is because you have to motivate yourself before you could motivate other people. And you have to, for nursing, you have to make sure that you keep their passion and their love for nursing, and to be lifelong learners, because nursing, you're always learning.
Mm-hmm.
You come to work, you could be a DON, you could be a certain position, but you're gonna learn something about nursing every day.
So what do you do to ensure your own leadership growth
That's
and
why I'm in
development?
school. That's why
What are you pursuing?
I am actually doing a dual master's. I'm doing nursing education, and also for a geriatric nurse practitioner. So I'm doing my nurse education piece, and then I think next semester I'll be their geriatric part.
So is there a key skill that you feel that all nursing leaders should develop in today's environment?
A key skills. You have to be intuitive, and you have to be able to adapt to changes very quickly. Not just changes, but adapt to certain personalities. Right now, the healthcare is a business, and for you to be able to serve a certain amount of patient and to be able to employ a certain amount of nurses, I have to ensure that that the place is financially sound.
And I understand you just went through an audit last week.
Yes.
Can you tell us a little bit more about that?
That is a very stressful time. I mean, when ACA visits yearly, and sometimes they visit sporadically throughout the year. They're testing and they're looking, they're observing what you practice every single day. And it's a test of what have you done the whole year. So they come there for 1 week and they're going to judge you on your whole year's worth of work for that 1 week. It is intense, it is stressful, but if you prepare throughout the year, every year it's a fiscal year. If you prepare throughout the year, it should be running smooth. They concentrated this year a lot about infection control, antibiotic stewardship, and you're going to hear a lot of this probably more so in the hospital, because we are in this environment of just ordering antibiotics, for whatever, and they are looking to make sure that you're actually advocating for your patient, because they realize the more antibiotics you use, you develop a lot of multi-drug resistant organisms.
And
so
super infections.
Exactly. So they're focusing more so on that this year than ever before last year. So they interview you, they look at your tracking. We tracked all our infections in the place. We tracked what we've done, and then certain things, certain infections, you have to report to the Department of Health. So they make sure that we're in compliance on those things, and they also make sure that our documentation matches what we put in our tracking, to make sure that if we started in an antibiotic for UTI, that there's documentation that they have a symptom. They looked at how you treat your patients. They observed how you treat your patients, how you dress them, how you speak to them. They observed during that time how you provide, because we provide food in the facility. So how you prepare the food, how you serve it to the patients. And
so the audit was pretty in depth.
And then they also, and the main focus of the whole thing is patient-centered care. And I think I talked about that in class, that the every single person, you do your care plan in class right now, and you by diagnosis. In a long-term facility, we do it by diagnosis, but also we do it based on the patient's desire, ability, preferences. So it's really, and your care plan would not look like my care plan. It's not like you go to the book and there's a diagnosis for hypertension and everybody has the same care plan.
Right.
No, it's a very patient-centered plan of care.
It's more individualized.
And they're looking,
since you really know your patient.
Yes.
So you make it
So
customized.
they're looking to make sure that what's on your plan of care mirrors your patient. So if there's a discrepancy between the two, then that's when they probably give you a tag. They're also looking at, we provide laundry in the facility. So they're looking at a laundry facility and how we handle infection control in the laundry. They look at, they focus on antibiotics, or they focus on psychotropic medications. A lot of our elderly, they see a use of a lot of psychotropic medications like Risperdal, Seroquel, lorazepam in the elderly. And in studies, they show that those things are really not good for patients, especially patients with dementia. So they're looking to make sure that you're attempting to decrease them, because most of these people lived in the facility for a long time. So they're looking at your attempts to reduce those psychotropic drugs, because they figure that those drugs increases your falls, increases your decline in function, and causes all other side effects that the patient should not have. They look at your staffing. So every single person has a role in that survey, and my job is to ensure that every single one performs.
So was your audit successful?
We
in
got
your
a couple.
opinion?
In my opinion, my staff did great. They gave us a couple of tags, but they're minor stuff that they're gonna come back, we're gonna correct, and they're gonna come back and they're gonna make sure that we corrected them. There's areas of improvement that I would like to do for the facility, and we already have our plan to do so for the to prepare for the next year, and we started actually yesterday. And usually we start when we have a plan, a quality assurance performance improvement plan, which you'll hear it when you work in this type of environment called QAPI, and you hear it in other places. You start first in your plan.
Mm-hmm.
You figure out what your plan is. Then you start in servicing and educating the staff of how what is their role in that plan. So it's a lot of education, a lot of in servicing, a lot of talking to them, a lot of return demonstration, a lot of them you have to test them to make sure they retain the information.
Right.
So
Excellent. So this will be our last question, Richelle.
okay.
So, what advice would you give to nurses going into a leadership position for the first time?
You have to know yourself. Before you could lead, you have to know what nursing means to you. You have to know what leadership means to you. You have to know what type of leader you want to be. I wanted to be a leader that my staff could look at and say that I'm involved, I'm engaged, that I'm not a desk leader, like in my office and you can't come to me. I have an open door policy. My staff...
So you're very approachable.
Yes, my staff, if they don't feel comfortable about something during, let's say, an emergency, they could call me. I run to the floor with them. And pretty much I lead by example. If I want them to present a certain way, to change something in the facility, to change a culture in the facility, I lead by showing them what I want them to do. I think that's important.
Well, Richelle, thank you so much for sharing the information with us. And,
Thank you.
For sharing your experiences. I think it's been very valuable, and we will learn a lot from this interview.
Thank you.
Okay, thank you so much.